Hello, I'm Stephanie Lawson, nurse practitioner student with Auburn University, and I'm going to be performing a head-to-toe assessment on my patient, Michelle Hogfield. I have already assessed her vital signs, her height, weight, and her vision using the Snellen eye chart, which also assessed her cranial nerve number 2. I'm going to start with her head, inspecting her scalp, hair, face, and skin. And I'm going to palpate her head for any nodules or abnormalities. Next, I'm going to palpate her frontal sinuses and her maxillary sinuses for any tenderness. Next, I will ask her to open her mouth and close your mouth, palpate and for her temporal mandible joint. And next I will ask you to cover one nostril and sniff. And now the next. Good. And as I am watching her do that, I assessed her septum, which is midline and symmetrical. I also will now ask you to tilt your head back just slightly. I'm going to look in her nares, noticing her mucosa is pink and moist. You can let your head back down. And now I'm going to check her eyes. I'll ask you to cover your right eye with your right hand. Now drop that and cover your left with your left hand. Okay, no drooping on either eye. Next I'm going to assess her eyebrows, her eyelids, no drooping, facing symmetrical. I'm also going to now ask you, let's see, let me do my ophthalmic scope. I'm going to look at her right eye using my right hand and looking for her fundus and red reflex and her left eye. Good. Now I will inspect and palpate her ears. Both ears seem symmetrical and even. And I'm going to inspect using the otoscope into both of her ears, looking for her temporal membrane, looking through the ear canal and for any abnormalities. And now we will use the tuning fork. I'm going to hit this, put it on top of your head, and you're going to let me know if you can hear it evenly in both ears. Let's see if I can hit it. Can you hear it evenly in both ears? Yes. Okay. And now going to check the run test on the back of your mouth story. Tell me when you can no longer hear it. Okay. And when you no longer hear it here. Okay. Okay. And we're going to check your cranial nerves. We'll check cranial nerve number 1, which is the smell test. See if you can smell this. Yes. Sorry. We have already checked the cranial nerve number 2 using the Snellen eye chart, and we're going to check her light reflexes. Check her light, the light with her pupils. And they react appropriately. And we're going to check cranial nerve number 3, 4, and 6 with the ocular movement, following my finger in 6 directions. So with your eyes, look up at this finger. Don't move your head, just your eyes. Down. Very good. And now we're going to check cranial nerve number 5. I'm going to let you clench your teeth. And again. Both muscles are intact and functioning well. Now we will check the cranial nerve number 7 by asking the patient to raise her eyebrows. Now to smile, show your teeth, and puff your cheeks out, and close your eyes tightly. Very good. And we check the cranial nerve number 8 using the tuning fork. And we will check cranial nerve number 9 and 10, which check the gag reflexes, so I'm going to use this tongue blade. So open your mouth to catch tongue. Good. Sorry. And now we're going to check the cranial nerve number 11, which is the trapezius muscles. You're going to push up with your shoulders against, very good. Now I'm going to move on and inspect her neck and palpate, inspect, and range of motion. I'll let you turn your head to the left and to the right, up and down. Very good. And I'm going to palpate your lymph nodes. And now I'm going to palpate and auscultate the carotid arteries. Next, I'm going to palpate the trachea and observe her jugular vein on both sides. Next, I'm going to assess for her thyroid gland, which I will do from behind. You swallow. Very good. And moving on, we're going to do the inspection of the back as I observe her respiratory pattern and rate. And I'm also going to be palpating for tenderness. The skin appears normal without any abnormalities. And tell me if you feel any tenderness at all. No. And I'm going to have you take a deep breath in and out to check for respiratory expansion. And now I will check for tactile phrenitis. I'll ask you to say 99. 99. And again. 99. And again. 99. Very good. And now I'm going to percuss the lung fields. And I'm also going to auscultate all lung fields on the back side. Next, I am testing for CBA, which is lower back pain associated with polynephritis. Tell me if you feel any pain. Okay. And I'm going to move around and inspect the chest for any skin abnormalities or any lesions or moles or abnormalities. I am also going to check the front lung sounds, anterior lung sounds, and check for tactile phrenitis in the front. Say 99 again, please. 99, 99, 99, 99. Very good. And I'm going to palpate for any thrills and palpate the apical impulse. Feel normal pulsations. going to percuss the lung sounds. And next I'm going to auscultate lung sounds and all four lung sounds and her heart also. Next I'm going to ask you to lie down and I'm going to auscultate her heart sounds lying down. And I'm going to also assess her pulses while she's lying. So I'm going to assess her radial pulse, her brachial pulse, her carotid, and her femoral pulse. While she's lying, I'm going to also do an inspection and assessment of her abdomen, checking for any abnormalities, skin and pulsations. And I'm going to auscultate all four quadrants and noting if there's any bruise. I'm going to palpate her inguinal nodes on both sides. And I'm going to percuss all four quadrants. And I'm going to check her abdominal reflexes using a sharp object, which she has normal reflexes. And now I'm going to palpate light and deep, noting the position of the different organs. Okay. I'll let you sit back up, and I'm going to do inspection of her arms and skin, noticing her muscles and any abnormalities or differences in either arm, both symmetrical and normal. Check her capillary refill by pressing on her nail bed, which is brisk. Now I'll let you grip my hands, squeeze, that's normal grip. Next, I'm going to assess for pain sensation. So I will let you close your eyes and tell me if this is light or light, hard, sharp. Good. You can open your eyes now. And I am going to test for her coordination. So I'm going to ask you to put your arms out, put your palms up and back down. Very good. Now I'm going to test her reflexes. And I'll let you bend your arm at a 90-degree angle. I'm going to check your tricep, bicep, and your brachial radial reflexes. So, very good. And very good. Next, I'm going to inspect her shoulders and palpate and make sure she has good range of motion. Inspect, palpate, no abnormalities, symmetrical. Now I'll let you raise your shoulders up, raise your arms out, bring them up and down, frontwards and backwards. Very good range of motion. And I'm going to inspect her hands and wrists and the range of motion. Let you flex, just round, very good range of motion in both wrists and hands. Next, I'm going to check her epitrochlear nodes, which are under your underarms, and no lymph nodes are swollen or tender under that area. Next, we're going to inspect and palpate her legs for abnormalities or lacerations, bruises, or the vein pattern. Next, we're going to assess the range of motion of her legs. And I'll have you lay back down and lift your leg up and down and outwards and inwards. Very good. And I'm also going to inspect her knees at this time and palpate for any abnormalities. And I'm going to also check the range of motion here. Bend your knee up and down. Very good. And I'm also going to inspect and palpate her feet and ankles at this time. Good range of motion to both. And now I'm going to inspect for sensation to your feet and legs. If you'll tell me if this is soft or hard.
Hard. Hard. Soft. Soft.
Very good. And now I'm going to check and palpate for pulses to her femoral, popliteal, and dorsalis pepius, and the posterior tibial pulse, which are all intact and have a regular rhythm. I'm going to let you sit up and inspecting her strength as she's able to sit up and move around. Next, I'm going to inspect your spine. So if you'll swing around that way and lean forward, inspecting her spine and her range of motion, lean backwards. Very good. And now I will check for the Romberg test. So if you will stand here in the front of the table. Stand with your feet together and your eyes open. Now I'll let you close your eyes and stand with your feet together. Slight swaying noted. Okay, you can open your eyes and walk forward just a couple steps to assess her gait. And now backwards. And turn back here. And if you will walk heel to toe, and we'll assess your balance this way also. Very good. And that completes our head to toe assessment for the day. Thank you, Michelle.
You're welcome.
Thank you.